Hello and welcome. My name is Anne Swanson, and I'm thrilled to be offering this presentation with Give Back Yoga, which is a virtual campus for yoga professionals, healthcare workers, and academic researchers to share their knowledge and exchange ideas. And this is a topic I've been really wanting to share because it's so relevant right now to give back yoga to the world with COVID-19, to just be able to take care of ourselves and breathe better. And really that's what it's all about. So I'll be talking about the neti pot and a little bit of research to support it. I actually am not talking specifically about the neti pot like we do in yoga, which involves tilting the head. I'm actually going to be talking more specifically with the research on these squirt bottles, because this is what's done more commonly from a clinical perspective, but it is pulled from yoga. The sinus rinse is pulled from yoga, from the neti tradition that has really stood the test of time. There's just this safer way of doing it. I'll be going through some of the safety precautions of using the neti because that's really important to stay safe. That's really what I'm all about. If you don't know me, my name is Anne Swanson, and I'm the author of Science of Yoga. So I really try to make things as simple as I can and practical as I can, looking at what the research tells us and adapting it to really practically fit into our lives. And right now, amidst the pandemic with COVID-19 and also allergy season arriving for many of us also, this is a really important topic to be able to breathe better. I am going to share my screen so that you can see my presentation. Well, first thing I wanted to say is that if you go to anneswansonwellness.com/immunity, there are so many resources that I'll be talking about through the presentation that are there for you. So I recommend you go there. You'll get the video of me doing the neti pot. You'll get a lot of research articles on not only the neti, but just the immune system in general. The research on yoga and meditation on improving your immunity is really growing. So I actually have summaries of those research studies that I can send you, as well as a handout that takes you step by step of going through the neti, how to use it, the safety precautions. But as we get started, I first want to just talk about why we would even use a sinus rinse. Why does it matter that we clear our nasal passages? So this is actually a picture from Science of Yoga right here. You can see deep in our head, we have basically a billiard ball worth of space right there at our forehead. And in that space in our skull, it's allowing for the air to move through your nasal cavities into the sinuses and resonate your voice. So that's a really important aspect, but it also has immunity benefits. It helps your immune system when you nose breathe. So let me break it down for you of the reasons why we want to nose breathe, which I think so many of us learn in our yoga teacher training. If you're a yoga teacher, or you may have just heard it's beneficial, you know, when you were a kid, they said to shut your mouth when you're at school, or maybe your grandmother told you to breathe through your nose. So it is something that is ingrained in us, but some of the reasons that we're seeing based off research and the science, the current science on it, is pretty interesting. So I'd like to go over that. But you can see that we have two choices for breathing. We have our nasal passage right here, but we also have a backup system, which is the mouth. And that's really there as a backup system because breathing is so important. We breathe throughout the day, and it's the one thing we need even more than something like water, which we can live for a while without. Can't live very long without air. So we have this nice backup system, and most mammals have this backup system, some don't, but pretty much all mammals are breathing through the nose. There's a few exceptions like dogs that can't sweat, pant when it's really hot. And there's a few exceptions of like inbred animals, but we breathe through our nose. That's what we're supposed to do. Humans are really the only ones that have jumped into mouth breathing as a default for so many of us. And a lot of us, it's because our nasal passages are stuffed up. So let's talk about how to breathe better. The first thing, number one, the thing that we're talking about today is to nose breathe. In India, they say the nose is for breathing and the mouth is for eating. So that is our ideal circumstance, that we're going to be breathing through our nose. And the reasons being is that it warms the air and it humidifies it. There's this mucus membrane in your nasal cavities and your sinuses that helps humidify the air. So by the time it gets to your lungs, it doesn't feel dry and cold. That just doesn't feel very good, and it's not the optimum state for your lungs to be able to do the most with it. But also, your nose has nose hairs, and the nose hairs filter out a lot of things coming in, whether it be pollution or viruses, bacteria, mold spores. All these sort of things can be caught initially by those nose hairs. But if we zoom in with a microscope, we can see even further that there are tiny cilia on the tissue of the mucosal membranes that are lining the nasal passageways. So cilia is like a mini hair you can only see under a microscope. And it is also catching the teeny, teeny, tiny particles. This is not, these things are not happening as well if you just breathe through your mouth into your throat. If you breathe through your nose, as I say in this point here, it slows the air. So it has more time to pass by all this nasal, the nasal hairs and the cilia and the mucosal membranes. The mucus is going to actually grab and trap things because it's sticky. So if the air is slower, it's going to have more time to be filtered better. Also, if it's slower, by the time it gets to your lungs, you are actually able to absorb more oxygen from the same amount of air when you breathe slowly. So it optimizes the amount of oxygen you can get from the air. It's not only about oxygen though. When we breathe through our nose, we also increase something called, chemical called nitric oxide. Nitric oxide is a vasodilator. So when we have nitric oxide, our blood vessels dilate or get bigger. And that allows you to have lower blood pressure, allows your heart to slow down and to go more into a relaxed state. So nitric oxide is an immediate relaxant. It helps you relax more. So there's another benefit to breathing simply through your nose. And breathing slowly is going to also increase that nitric oxide because it's here in your nasal cavities that it actually touches the air, fills the air, and by the time it gets to your lungs, now it has more nitric oxide in it when you nasal breathe. And also, in addition to catching these invaders, the last point I have here is that it fights invaders. So if we look at the mucosal membranes that are lining these cavities and we zoom in with a microscope, we have a lot of different immunity complexes, one called immunoglobulins, which is like the coolest word. I love that word. And immunoglobulins are actually fighting viruses and bacteria. So we have all of these immunity complexes that are helping us fight the antigens, the invaders that are coming in. As I already mentioned, other species are nose breathers and don't really breathe through their mouths. And we can also look and see that other species, other animals, other mammals specifically, all have straight teeth. We're the only ones that have to get braces. This is kind of a big thing because this is meaning that we have gone through a disevolution over time. We are actually, our nasal passages and our breathing passages are getting smaller, and that's what that's representing, those crowded teeth. And it's a lot to do with our diet. We're eating really soft foods, especially at a young age, where we really need to develop a wider palate so that we can breathe better. And a lot of us just unfortunately haven't. So we have a more narrow passageway for the air to come in, which can lead to issues like snoring, allergies. That's what my big issue is allergies. I snore every once in a while. I don't think I've done it in a while. It can lead to mouth breathing, which, as we just talked about, is not optimal. So when you look up mouth breathing in the dictionary, this is what it says. A stupid person. So which came first? Is it that people with lower intelligence tend to open their mouths when they breathe, or breathing through your mouth makes you not able to think as clearly? You're not getting the optimal amount of oxygen from the same amount of air. You're also exposing yourself to more viruses and bacteria when you mouth breathe. Here's a little picture you can see of the viruses coming into your nasal passageway, and in the air, if we zoom in, they're all in there. So it's about your nasal passages catching it. But moreover, is that the neti can help rinse out that virus that may be lodged in your nasal passages. So it can also cleanse and help you create new mucus that's fresh and ready to tackle new viruses. Well, let's talk about a few other ways, because obviously I'm focusing on the neti, but let's talk about a few other ways that you can clear your nasal passages so that you can breathe better. So, first thing is just nose breathe. By nose breathing, by practicing nose breathing, more often closing your mouth, catching yourself, practicing it, your nasal passages are going to change and shift. Our body is highly adaptive, and so our nasal passages will actually widen. Our sinuses will become more efficient at doing their job when we nose breathe. So it becomes easier over time the more you do it. If you are a mouth breather, whether it be during the day or at night, this is a shift that may take some time. As well as while exercising, while doing a yoga class, it's not good to be mouth breathing. You're maybe pushing it too far if you catch yourself mouth breathing during a sun salutation. Can you close your mouth, shift to mouth breathing, maybe adjust your level of effort so that you can build the capacity to to nose breathe more during the physical activity. But I think for so many of us, the issue with mouth breathing is nighttime. My whole life, I have just been waking up almost every morning feeling so thirsty. I have to have a big bottle of water by my bed, or else I feel a little panicked. And I'm so thirsty, I have to drink lots of water. Like, I have to. It's not just I'm doing it because it's good for my health. And I always thought it was strange that at the same time, I also have to pee really badly. So why am I so thirsty and I have to pee? It doesn't really make sense or add up. And I mentioned it to people through the years and mentioned it to doctors, and nobody really explained it well to me. But then I heard an interview with James Nestor, who wrote the book Breath, and he was talking about how it is a sign that you've been mouth breathing the whole night. My mouth is so dry by the time I wake up. That's why I'm thirsty. But I've lost a lot of air, a lot of moisture in the air by mouth breathing. Remember, the nose breathing helps you retain more moisture by rehumidifying it. When you mouth breathe, it starts to get your throat really, really dry. So that's that thirst aspect that I'm having. So the idea is, how do I train myself to breathe through my nose at night? One thing that helps is regularly doing the neti for me. That is one thing, and we'll talk more about that in a moment. Another thing that is recommended based off of research is taping your mouth. My dentist actually has me doing this. So you take just really 3M medical tape, and it's teeny tiny bit. You're not doing like duct tape across your mouth. And of course, if you have any traumas, this would be uncomfortable. Don't do it. Don't do it to children. The thing is, though, it's a teeny tiny piece. I really do a piece this small. You put it right over you can see that my mouth could still kind of open a little bit. That's okay. What I'm trying to prevent is that, like where you wake up with a pile of drool next to you. That's what I'm trying to prevent. So I did this for a few weeks. Sometimes I'd wake up with it on the pillow. Sometimes I would take it off. Like, what is this? I guess the worst that could happen is you could swallow it. I don't think you would choke. It's teeny tiny bit. But after that, I started to train myself to breathe more through my nose at night. And I'm finding that I don't feel that extreme thirst in the morning. Some people have to continue to use it, but I found it was just helpful to try it and test it out a little bit. And another thing for me with a really narrow nose passage, like I have just because of genetics, is these Breathe Right nasal strips at night. So you just stick it on there, and actually try this right now, better without the glasses. Take your fingers on either side of your nose and just like open them a little bit. Take a few breaths. Notice how you probably can breathe a lot better when you open your passage. That's what this is doing. If you snore, this can help prevent the snoring, but also just help you be more likely to nose breathe, especially if the tape feels weird to you. And especially if you have a deviated septum, which I have also, or a very narrow nose. People always joke like, oh yeah, I snore, my husband snores, it's so cute, he has to go out or it's so annoying. And you just kind of joke about it, but it actually is a sign that you're not breathing well at night. And it's an early sign towards more serious issues and more serious sleep disturbances, sleep apnea. So it's good to tackle snoring. Sorry, there's an ambulance coming by. I'm in a city right now. I'm actually living in Honolulu in Hawaii because I've been searching for a place to live that had less COVID. I don't actually have a home, so I just kind of nomaded around and just waiting for those ambulances to go by. So this is really helpful for me also to breathe better at night. Let's go back to the presentation and I could talk a little bit more about the Neti, which is, I know what you came here to talk about. So the other thing is the Neti, or sinus rinse, we often call it, or nasal irrigation is another name for it. I already showed you this. This is what the Neti is basically filling up. When you take this squirt bottle, you squirt the saline solution up into your nasal passages, it's going into the sinuses and then it comes out the other side. So you're just cleansing that passageway, getting any pollution, like if you're in a very polluted area, sometimes like when I was in China, like grays and browns come out. It's grosser when you're in a polluted area, but I'd rather get it out than it go to my lungs. But it often won't look like anything. It'll just be clear. And what's happening is the salt water is cleansing the mucosal membranes. And the salt water actually supposedly stimulates more new mucus to be created. So first off is safety is the most important thing. Ask your doctor. I'm not recommending that you do a Neti, or if you're a teacher to go tell all your students to do a Neti. I think you need to ask your doctor, ask your allergist. My allergist has me doing it. She recommends twice a day, 2 bottles each nostril, or 1 bottle each nostril, which is more than I actually do. So I tend to do a couple times a week, depending on the allergy season. But I worked with my doctor to find that amount. Especially if you're unsure. However, the Neti is something that is over the counter. It's not something you have to get a prescription for. To be safe, I'm just going to tell folks, if you're unsure at all, ask your doctor. Make sure that you read and follow all the instructions on the box. So that's really important. It comes with kind of a thick instruction packet. The reason being is that a few of the key instructions that I'm going to highlight now are so important to prevent infection, or even there's been a few cases of death. So if you use water from the tap, like just water right out of your sink, there are amoeba in that water that we drink. That's fine for us to drink because our stomach acid kills that amoeba. But if it goes into your nasal passages, that amoeba gets stuck in there and propagates, and you can actually die. So don't use tap water. That's the biggest thing. You want to use bottled water, or ideally distilled water is the best, but you can use just a regular bottle of water. You can boil your water for at least 5 minutes. Sometimes when I'm traveling and I get a bottle of water, like in South America, I even will boil that for 5 minutes. So I just like to be extra careful about using the water. Also, you want to use the right salts. So with whatever neti you buy, which I'll also send you a link to the one that I like, the one my doctor recommended to me, which is the Neti Sinus rinse. A little different than the bottle that I have here now. This is just what was available at Whole Foods here, is this style. They both work. But the Neti Sinus rinse comes with these little packets of salt. Let me make myself bigger so you can see for a second. So these little packets of salts, you always want to use the salts that it comes with. You don't want to use salt from your kitchen or anything. This is very like specific salt that you'd use. All right, get back to the presentation. So use the right salts. Another thing that can prevent some of the issues like infection or even the water going into your ear cavity is not to tilt your head, which the traditional neti, which you can see on the top left of this picture, that blue pot there, the traditional neti is like a pot. So when you use it, you are holding it and you tilt your head like this. Sometimes now if I have to use one of those, I just try not to tilt my head very much, but we always learn to tilt your head quite a bit. And it can actually get into your ear, and that's something we want to avoid. So this is why, one of the reasons why this is what I think is a modern adaptation of this tried and true technique is these squirt bottles, the sinus rinse squirt bottles, because when you use them, you don't tilt your head at all. You just lean forward. So it reduces that risk. It actually gets rid of that risk. So that's why I use that rather than the pot itself. And if I were to use a pot, I really try to make sure I'm not tilting my head. And then you want to replace it often. I also love these compared to the pots because like they say, often they say 3 months and then you throw it away. If you're ever unsure, just throw it away and get a new one. So you're replacing it and you're not sharing it with anybody. So this is a step-by-step that I have for you that I'm going to break down for you. And you will get this as a handout in that email when you sign up for AnnSwansonWellness.com/immunity. So this handout takes you through it step by step, as well as there's a video that goes with it to show. So first, always ask your doctor or allergist, especially if you're not sure if this is right for you. Some reasons it might not be right for you is if you are like extremely stuffed up. If you have a very, very deviated septum and it's like you can't even like do it and the water's not even coming out the other side, would definitely consult your doctor about that. If you've had a recent surgery on your face, your nasal passages, your ears, you'd want to wait after that surgery and consult your doctor about that. And if you're just unsure because of whatever your circumstances may be, always good to talk to ideally an allergist because they really do specialize more in this. I use the Neti Sinus rinse, which as I mentioned is a little different than this bottle. I like it better. And I'll send you that link to that one. You can get it on Amazon. You can get it at a lot of drugstores also. And I use only distilled water or water that's been boiled for over 5 minutes. As I said before, sometimes I'll get a bottle of water and I'll also boil that as another way. If you're using water that's just distilled, you can actually heat it up just in the microwave. So that takes down some of the prep time compared to boiling it. You then have to wait for it to cool after boiling it. You want to also replace it every 3 months and don't share. So this neti tradition is from Ayurveda and yoga. I used it in my teacher training. We did it in my teacher training together. I think that some places do that in their teacher training. I had teachers from India So that might have been why. I've heard people in the US and Canada say that they have done it in their teacher training too. I just want to point out one thing before I take you step by step that I just think is very important. We're still understanding what is the scope of practice for modern yoga. And there's lots of different philosophies and points of view. So in my point of view, we really want yoga to be yoga, not just asanas and the poses. It needs to include, as a yoga teacher, I'm including meditation and breath work and these kriyas. That's what this is. It's a kriya. It's the cleansing technique, the neti. So I'm using the one kriya that's like a modern one that is shown to be really helpful. I'm bringing and continuing that tradition. As well as chanting, which is really good for your breathing and increases nitric oxide also, and that can be really helpful. So I'm trying to use all these tools of yoga. And so for me, it's really important, you know, a lot of yoga teachers may say, oh, do a neti, but then not to give the step-by-step and the instructions on how to be safe doing a neti. That's where we start to have issues. Just recently, I talked to my insurance company, which is Be Yogi, and they said that they don't cover teaching the neti. And I haven't called all the others yet to see. I can see why they don't cover it. I think a lot of yoga teachers aren't explaining the cautions, the precautions, these things, these simple things that I'm telling you now and highlighting. They may not be pointing them out, and they're very important, you know, to emphasize. Don't just use the water in the shower. I had a boyfriend once, that's how he did his neti. He'd, in the shower, just fill it up with the shower water and do it right in the shower. And somebody at yoga told him to do a neti, and that's how he did it. He could have gotten that amoeba, he could have gotten infections, it could have been deadly. So I think the issue is that yoga teachers aren't trained to actually tell the precautions of it. So I'm very careful. I just say, consult your doctor. This is not me like recommending that you do it. I'm telling you the benefits of it. Here's how you do it. But you need to know, you're the one that knows all of your circumstances, and you and your medical team can talk about it if you're unsure. So I am thinking about calling around the other insurance companies and seeing which ones cover them, but I think it's not going to stop me from telling people the safety precautions, because I think that if I don't tell them, then people are going to go in the shower and do it right. Actually, he was doing the pot in the shower, so he's tilting his head too, and people are going to do that. So I think it's important that I cover these safety precautions. But I'm also not just teaching it to a group of people in a class, like in a teacher training. I'm just giving you the information, and then you make that informed decision. So I did want to point that out. I just found that out a couple days ago, that they specifically say they don't cover neti. And I think it's important that these insurance companies start to understand that yoga isn't just about the poses. There are other things. But I also think it's important as yogis, as yoga teachers, as an industry, that we also inform ourselves, educate ourselves, make sure we're really explaining the safety. Okay, let's go through it step by step now that I explained that. So in this handout, you'll see the first thing is wash your hands. So you want to have a clean environment and wash your hands thoroughly. You want to warm up the water also. Between some of these steps, you might need to wash your hands again if you went and did something while the boiling water happens. But you can boil it for 5 minutes, or you could heat the distilled water in the microwave. I take the bottle, and this is actually what the instructions say, is to take the bottle with the distilled water and just rinse it, or with the previously boiled water. Because you have this, like you just saw, there's water droplets in my bottle from just using this a couple days ago. So just want to rinse that out in case any bacteria has come into the bottle. And I rinse the top of it out too. It's a little different top with the Neomed, but I rinsed that. And then I'm going to, after I've rinsed it, I'm going to pour the water in there, that boiled water or distilled water that has been warmed. And I'm going to add the salt packet. I pretty much just add the whole salt packet. So I fill it up to the line it says to fill it up to, and I put all the salt in there. If you use too much or too little, it can sting a little bit. It can sting a little bit. It's really not that bad. But if you use this amount, it really hardly ever stings. So just doing the right proportions that they give you. Then I shake it. I close the cap and I shake it a little bit with my clean hands, just cover it and shake it. From there, I think I added to the most recent version. I have it right here. You test it by squirting it onto your hand. You need to be able to feel it on the back of your hand, this very sensitive skin right here, that it is not too hot, not scalding hot. You don't want to burn yourself. So test it on your hand. The next step is to actually do it. So you lean over, you don't tilt your head to the side, you lean over and squirt. I'll just squirt as much as it'll let me. And sometimes it takes a few moments, like up to for me, it can be like 10 seconds or so. Sometimes a little more for the water to go through the passages and come out the other side. Sometimes it just feels like longer. So once you've done that and you've done enough to feel comfortable to get that out, you're then gonna cover this passage. I just did it in this nostril, right? So now I'm gonna cover that same nostril and I'm gonna blow a little bit. I'm only partially covering that nostril. This is important that you don't put all your pressure and blow with all your might, because that could affect your eardrums. It's just a partial pressure and a gentle blow. Leaning over, you'll see some water spit out. Sometimes if you have some boogers, they're gonna come out too there. You may want to do another go on that nostril, or you can switch if you're ready and do the other nostril. Same thing, squirting in that other nostril. When you're done, cover the nostril you just squirted into, gently blow and empty it out. At the end, I usually blow with tissue, or whenever I need, I use a tissue to blow also, because something interesting can really happen. And if you've done a neti, you know, 10 minutes later, you'll go into a yoga pose and all of a sudden water comes out. So it's important to do that blowing step, and it still may happen 10 minutes later. It's recommended to do this more in the morning or afternoon, not so much in the evening where you're gonna lie down right afterwards. It's better, I find, to really do it in the morning as a ritual to get ready for the day, and then you can breathe better. But as I said, the dosage is really dependent on the person. So like my allergist wants me to do it twice a day. It may depend on your allergies or whatever it may be, but generally speaking, it may just be advantageous just for once a week for you to start and doing that, especially if it's just for COVID relief. Let me talk a little bit about what it can do with COVID. That's where the interesting stuff is relevant to this moment. So basically, as soon as this pandemic hit, we know that lots of researchers just jumped on it, whether it be to find vaccines, to find cures, anecdotes, things that are going to help, gathering all the information. And one of the things was looking at other coronaviruses. So previously, we have a decent amount of research on other coronaviruses. And if we can assume that they're going to behave in a similar way as COVID-19. So some of these research studies I'm talking about now are doing just that. They look at all the research they found of other coronaviruses. And they said, okay, did the nasal sinus rinse help? And they did find that it helped in treating and preventing upper respiratory tract infections. So there's this study, which I'll link in those resources that I'll send to you. You can also just look it up. There's the information. This one is also really interesting because they did a combination of doing the saline nasal irrigation or sinus rinse or neti pot and just gargling a little bit of salt water, which is so interesting to me because growing up, my dad would always say gargle salt water, and you're like, wonder, is this just a wise tale, or is there some truth to it? Well, it seems to be really helpful, the combination of the two of those in cleansing, and it may be helpful in reducing the length of the illness for like COVID-19 or coronaviruses in general by 2.5 days. That's huge, 2.5 days less with COVID-19. But also it showed to reduce symptoms of stuffy nose, cough, hoarseness of voice. So if we can reduce symptoms and we can reduce the length of the illness, then you're less likely to actually go to the hospital and for it to progress worse. But this other research study was looking also at preventing it. Oops. And they saw that it was when you use the sinus rinse, it was likely that you could squirt out the virus, or you're also encouraging your mucus to function better and your immune system to function better, and helping you nose breathe more, which, as we know, there's all those benefits to nose breathing to help your immune system function at its optimal level. So this is why it's so important to nose breathe, and how Neti, if it's right, could help. I'm definitely open to any questions. If you're watching this later and you think of a question, you can write me on my website, or respond to one of the emails. And I would just like to end now with a little nose breathing meditation. I know I can talk a mile a minute, and we covered a lot. So I want you to just soak in what you covered. And really, the take home message is to close your mouth more often. Breathe through your nose. So take a moment and sit wherever you are and feel the energy slowing down. Notice what it feels like to breathe through your nose right now. Is it easy? Is it hard? Does it help it if you bring your fingers to the outside and pull your nose a little bit to the side? What happens if you take a little bit deeper and slower breaths through your nose? Just by practicing nose breathing, you enhance your ability to nose breathe. How does it feel to have your mouth closed? Does this feel natural? Do you personally tend to open your mouth when breathing? Maybe at night, or you wake up with the same dryness in the morning. How much do you mouth breathe? Maybe you'll notice in the next 24 hours. And what happens when you slow your breath even more? Breathing in and out of your nose. Can you feel with the inhales, the breath, the air is a little cool. With the exhales, it's a little bit warm and humidified. Can you feel that? You may even want to put your fingers under your nose to feel it. Almost like you're feeling like fogging up a mirror. Can you feel the difference from the inhale and the exhale, and how your body transforms? Take 3 more breaths here. As you're finished, we might have somebody here that has a question. Feel free to ask your question if you have any, but you're also welcome to reach out to me afterwards if you have any questions.